Let's get it lit.
It's the Silver Edition on Star 919. October is Breast Cancer Awareness Month, but to be completely honest with you, it's something that we should be focusing on year round. I mentioned earlier that we're going to be chatting to somebody who's in the know. Dr Nirasha Chiranjan is a radiation oncologist and has been in this field for a number of years with a special interest in the breast, gynecological, head, neck, central nervous system areas. She's also an active participant in several multidisciplinary forums related to cancer treatment. Dr. Chiranjan, thank you so much for joining us on Star 919.
Oh, thank you very much. I'm happy to help during this special month of October.
Wonderful. I think everyone can say that they know somebody who's been affected by cancer and breast cancer. So this one I think is really important. Doc, I think to start off, if you find out that you have breast cancer, is there a way to know that you can get it treated, or is it like, oh, you've got it, that's it, you need to start writing your will, planning the end of your life, like final things?
No, absolutely. So I think if you're diagnosed with breast cancer, you must remain calm. We have a number of treatments, whether it's early stage or late stage breast cancer, that are effective and will result in either cure or prolonged survival. Really, the message is to actually know yourself and do breast self-examination. Yes. Go for your annual screening mammography, and just to be aware of it in males and in females. Because remember, male breast cancer is also on the rise.
100%.
So just to be aware.
100%. Yeah. So it's for those who are scared, because there's people, they're too scared to find out they've got a lump, they've got a situation that they're not sure about, and they're like, oh, I'm too scared to go to find out. But the longer you wait, the higher your chances of it not being treatable. When should you start going for breast exams, male or female? Is it 20? Is it 21? Is it as soon as you start your cycle? For ladies, is it like from 40, from 50, from 30? What's the go-to with this?
So I think the recommendation is really from the age of 40 to have 1 to 2 yearly mammograms.
Okay.
But I would say from a young age to do self-breast examination to know your breasts, so that you can actually detect if you feel a mass or you feel something differently. Often women will present with a breast mass, or sometimes breast skin changes or axillary adenopathy, and at other times it's an abnormality that's really picked up on routine screening. Patients will then tend to have a breast mammogram, a sonography. We can do MRIs for patients with, who are high risk. So they've got family members with a family history of breast cancer, or they've got dense breasts. And then really what happens then is you have a biopsy, and that determines really the histological characteristics and the hormone receptor status of the breast cancer. And this then guides our treatment recommendations. And then patients will then go on to have a staging workup, like a CT scan, to check if the breast cancer is actually spread anywhere else.
When it comes to actually checking, you mentioned, I think you said something axillary. What is that when it presents on the skin?
So that's lymph nodes in the axilla. So you might feel into your armpit and say, hey, I don't know why I've got this round ball, or this growth in the axilla.
Sure. Okay. So I want to make this as sort of digestible as possible to the layman, because a lot of people haven't done the reading on it. They don't know. They're just like, oh, I've got a lump, but it's under my armpit, so it can't be anything. It's maybe just like a sweat gland that's swollen. It'll go away after a while. But that's part of the breast tissue area going all the way up. So when you're doing your check, you should be going from the top of your chest all the way around a pectoral muscle, all the way to under the armpit.
Yes, absolutely. And I think even as individuals, we must have a low threshold for seeing our GP or for further investigating these masses that are painless, because that's how breast cancer presents. It's a mass, it's painless.
It's painless.
And so really we must, if we see something and it's not changing and it's progressing, causing discomfort, don't leave it till it's too late.
And if you do find like a mass or something that you're worried about, who is the person that you go to? Do you go to an oncologist? Do you go to your GP? What's the next steps?
So I would say first and foremost to see your GP.
Okay.
And they will often refer you to an imaging center where they're able to do a sonar and check is it a benign lesion or a malignant lesion, and then do an FNA or a biopsy. But I think the first port of call is your general practitioner.
And you mentioned earlier that mammograms are probably the way to go from the age of 40 onwards. That's generally for women. What do men do?
The same. So we also do a mammogram for them, but often, remember, there's not a lot of breast fat in men.
That's
so it's often, it's correct, it develops underneath the muscle, so they tend to be more aggressive. So they should have a low threshold. If a man has a breast mass, he must see his GP, must do a mammogram, must do a biopsy.
Straight. Okay, so GP probably the way to go, and then just self-examinations. If you find something, go to your GP, and then from there. So, because I've never heard of a man going for a mammogram, because the vision I've got is you put your boob in the machine, it squashes to do the reading. I mean, men generally don't have a lot to put in there. How?
Yeah, so they would do a sonar as well. So we could do a sonar and a biopsy that way.
Got you.
But I think with our often with breast cancer screening, you see a picture of a woman.
Yes.
And you think that it's more common in women, but actually it occurs in men as well.
When you
so
say
we must have a low threshold.
When you've said that a couple of times now, what is like the percentage distribution for breast cancer between the genders?
So I think it's the incidence in men is much lower. It's about 1 in 700 versus 1 in 27 for women.
Okay.
So it's actually very much more common in women than in men. But remember, if you're a man and you've had female relatives with breast or ovarian cancer, or you carry the BRCA gene, then you are at risk of male breast cancer.
100%. Oh, I didn't know that, because I mean, it was all over the media when I think it was Angelina Jolie decided that she would do I don't know if it was full mastectomy, because she found that she had that gene, and her mother had gone through I think breast cancer treatment, and I don't know if she'd passed from it or not, but how do you find that gene, or like how do you do that test? Is there something that like anyone can do?
Absolutely. So it's BRCA testing, and it's done by a geneticist.
Okay.
And usually you'd have to have an assessment to see if you or a family member carried that gene. So if you've got family members who at a very early age are diagnosed with breast or ovarian cancer, then often they will do a family tree, and then they will test for your BRCA gene. Yeah.
Interesting. Doc, I think I know the answer to this, but I do want to ask anyway. Is there a way to prevent cancer, whether it's breast cancer or other types? Because, you hear about, eat this and you'll do this and try this and it stops the cancer, and things that you should avoid doing if you want to lower your risk.
Absolutely. So there's behavioral choices, and then there's interventions that actually reduce, for example, the risk of breast cancer. So it really is just having a healthy diet that's rich in grains and vegetables and fruit, and to reduce your processed foods. Wow. You want to exercise regularly. You want to maintain a healthy weight. You want to avoid smoking and tobacco products. And this really includes your electronic cigarettes and your vaping devices. You also want to limit and avoid alcohol. You want to get regular health checkups and screenings, which is actually available at most primary healthcare clinics across the country. You really want to promote breastfeeding. There's this protective effect of breastfeeding that's really shown in multiple studies, and the magnitude of which really depends on the duration of breastfeeding. So they did a study, and they found that for every 12 months of breastfeeding, you've actually got almost a 4.5% reduction in the risk of breast cancer. And it's thought that the mechanism for this protective effect is really that it delays the reestablishment of your ovulatory cycles. With regards to physical activity, breast cancer risk is much lower in physically active women compared to their least active counterparts.
Wow.
And the reduction in breast cancer is thought to be basically from weight control and the effect that exercise plays on your circulating hormone influences. And then with regards to diet, so it's a low-fat diet, and this pattern's been associated with reduced deaths, especially if you've had a breast cancer diagnosis and you're postmenopausal. And then a diet that's rich in fruit and in vegetables, like the Mediterranean diet, or a plant-based diet, because this really helps decrease your breast cancer risk. And then we have medical and surgical risk reduction strategies. So we've got chemo prevention, so that's the use of aromatase inhibitors in postmenopausal women, or tamoxifen in pre or postmenopausal women. So this helps reduce your breast cancer risk. And then mastectomy, like you said, Angelina Jolie, she tested for BRCA, she was positive, so she did a mastectomy, and this helps reduce your breast cancer risk. And it's appropriate in select patients. So those, for example, that are carriers of certain genetic mutations.
Jeez. You mentioned earlier I think you said which one was it?
Aromatase inhibitors. It's
Yes.
a form of endocrine therapy that reduces your estrogen levels. And so you'll find that you have a reduction in your breast cancer risk.
So the higher your levels of the female hormone, the higher your chances of getting breast cancer.
In a way, yes.
Essential.
Often our ovaries produce estrogen and then our fat produces estrogen. So if you're more overweight, you're more likely to have high estrogen levels. And then for women after the age of 50, for example, who remain on hormone replacement therapy for many years,
Yes.
in their 60s and 70s, they are also at a higher risk because of the exogenous estrogen that they are exposed to.
Insane. What I find fascinating about this is that these are natural hormones in our bodies, yet it is something that could lead to us being incredibly sick. Do you think it's from just the, I suppose, increase in things, I know plastics, if they're not BPA free, etc., they have more, you've got estrogen in them, and then it's a surplus as opposed to the natural level. Is it more of a surplus of estrogen?
Sure. That's what they sort of, think that it's actually our environmental factors. For example, the food that we eat, and it could be related to a Western lifestyle.
Yeah. Too much of the fast life, hey? It's not good for us. My goodness. Doc, thank you so much for this chat. I know you said mammograms from the age of 40 onwards. I know of a few women who presented with breast cancer in their early 30s, and they did this from self-detecting. How many times a month or a year would you say we should do a self-exam? Is once a month okay, or is it like a twice a month thing? Should you do it yearly, just so we can start getting in the habit of knowing that this is something that we need to live with?
Yes. So I would say as a guideline, you should do it once a month, and it should be not during your menstruation, because you have cyclical changes during that time. And I think that if once a year or every 6 monthly you had a clinical examination with your GP, so I think that's also quite reasonable, and it depends on your risk. So if you're low risk, maybe once a year is reasonable. But if you're at a higher risk, then I would sort of advise more often screening.
Dr. Nirasha, before I let you go, what's one piece of advice that you would like more people to know about breast cancer during Breast Cancer Month?
So, Breast Cancer Month, for me, I think it holds a lot of importance. It's a month created really globally to share our support to our patients that are affected by this disease, and really to bring attention to the struggles faced by our patients and their families, and to increase surveillance and early detection benefits. And it's such a symbolic month, and I just want to relay sort of this message to sort of all South Africans to be aware of the danger of breast cancer, and really the importance of early detection, and the fact that early detection can save lives.
100%. Thank you so much, Doctor. Really appreciate your time. This is radiation oncologist Dr. Nirasha Chiranjan, giving us all the info that we need this Breast Cancer Month that we can carry throughout the year, 365 days, and hopefully you'll be able to pass this on to those around you. This podcast will be on star919fm.co.za. I'll try to get it up before the end of the show. Dr. Nirasha, thank you so much for your time. Really appreciate it.